So for all intents and purposes, I'm a chronic sinusitis sufferer. And the reason why I suffer with this problem is because my anatomy is not favorable. My plumbing is not ideal. So all of my sinus openings are quite narrow, which predisposes them to developing infections. So the plan today is for Dr. Wassmuth to go in and dilate and open up all of my sinuses. I had a really severe sinus infection here recently. I scanned myself when I was symptomatic and my sinus looked pretty bad. I was finding myself to be a surgical candidate. And as soon as that came up on my radar, I had Dr. Wassmuth review my scans with me and he agreed that I was an ideal balloon sinuplasty candidate. So whenever I get a sinus infection, I feel crummy. I have a bad headache, I get into a mental fog, feel a little bit fatigued. And my whole end goal in undergoing this procedure is to prevent those sinus infections altogether and really increase the number of good nasal days that I have.
So these are Dr. Dharamsi's preoperative scans, and I won't go into great detail, but in general, these scans are supposed to have lots of black air in the sinuses, and he is completely full of mucus. And so this poor guy has been treating and seeing patients for forever with sinus problems, and he's ignored his own problems. On a scale of 1 to 10, he's probably an 8 or a 9 out of 10 on the sinus scale.
When we looked at my sinuses, we saw that I had not just mild sinusitis, not just minimal sinusitis, but moderate to severe sinusitis affecting the large majority of my nose. So I'm hoping that when we get in there, when Dr. Wassmuth gets in there, he's able to successfully get his little dilator in all my sinuses, make those openings nice and large, restoring my normal plumbing and outflow of my sinuses, therefore preventing me from getting these sinus infections in the future, and also making it easier for me to breathe through my nose.
Dr. Dharamsi is an interesting patient. He's not only my partner, he's not only a doctor, he not only does this as a living, but he's also like many patients and he's ignored his problems for years. He has been my partner for almost 3 years and he's complained about sinus issues and he just keeps putting it off. What will be interesting is to see how quickly and how much benefit he gets from this. And I bet you he'll wish he had done it 5 years ago. So even us doctors are just like everybody else. We put it off until the last minute.
So one of our main goals of me undergoing the sinuplasty procedure with one of our doctors is to show patients that, look, chronic sinusitis is a common issue. Technology has advanced to such a degree today that it doesn't have to be a big ordeal to get it treated.
So Dr. Dharamsi's had a long history of chronic sinus problems, and today we went in to finally fix those problems. We went in to fix the anatomical issues. So most likely his problems have stemmed around narrow drainage pathways and mucus that just stays stuck. And so we were able to dilate his sinuses with a little balloon and then rinse the sinuses out. So now his sinuses are open and nice and clean. One of the things that we're trying to do more and more of is connect the surgeon to the patient's sinus scan so that we know exactly where we are in surgery. So today we used a brand new system that allows us to track the wire that the balloon goes over. So the entire time I knew where my wire was going and it helped guide me into the sinuses quicker and safer. And then I floated the balloon over the wire and was able to dilate the sinuses. In his cheek sinuses, when we got the sinus dilated, that's when we did the irrigation to get all the mucus and things out. It would be interesting to see how Dr. Dharamsi is doing. The procedure's been over for 15 minutes, and it would be interesting to see how well he is doing already. Until we go take a picture of him?
Yes.
All right.
So surprisingly, I mean, it feels like it's been 10 seconds, but it's probably been about 10 minutes since I've had my sinus procedure done. I feel great. I feel like I could drive home, for other reasons. I'm having a ride come pick me up, but I feel amazing. Already can breathe a lot better through my nose. Yeah, it was one of the easiest things that I've ever done, and I was surprised at how easy it was.
Do you remember anything? Did you feel anything?
All I remember is talking to Dr. Wassmuth and just kind of cutting up with him a little bit, and that was the end of it. So yeah, didn't feel a thing.